Hello, welcome to Senior Moments, the show where we talk about all things senior, the good, the bad, and the utterly ridiculous. I'm Susan Tomasich, and today I have with me Dr. Dean Kelaita, who also happens to be my personal physician, so I trust him, and I know that he'll give us good information today.
I'll do my best.
All right. So we were talking about Alzheimer's drugs, um, and I'm just going to tell you right now, I can't pronounce any of these things. I call them the LMAB, the DNAB, and the AMAB.
Yeah, there's a few new Alzheimer's medications. There's some that already have been on the market for a while. Then there are a class of some newer Alzheimer's drugs. Alzheimer's disease in general is a degenerative condition of the brain. And you tend to accumulate this stuff that's called amyloid in the brain on autopsies, and it interferes with normal neurologic functioning. And Alzheimer's disease, because it's a disease of aging, is going up in incidence because of the aging of the population. And so that's why there's more cases of Alzheimer's disease, there's more discussion in Alzheimer's disease, and it's a really hot area of research because finding treatments or cures or preventions for Alzheimer's disease is going to make a huge impact in the health and well-being of Americans because it's a pretty bad disease. It really impacts not only the people who get it, but their families and their caregivers, and it can be a really devastating disease for patients and for their families. So there's a couple of Alzheimer's drugs which have been around for a while, and they work okay. They don't arrest the disease in the sense that they make it go away or they cure it or they fix it. They just prevent the progression of the disease. So ones that are in that category would be Aricept, Namenda. These are oral medications which have been around a long time, and they're pretty much in common usage. And then there are a couple of newer medications, newer classes of medications, and those are injectable, and some of the ones that you just named off. And they're still kind of in their research phases, although two of them have been approved by the FDA for use. They're injectable medications, and they hold a little bit more promise on reversing some of the effects of Alzheimer's disease if used early in the course of the disease. They're injectable medications, and there's an oral version of those that's coming to the market. But the best advice that I give to patients, it's not unusual for people to come in to see me in the office, and they'll say, hey doc, I'm getting Alzheimer's disease. You got to straighten me out. And really, they're not getting Alzheimer's disease. They're having a concern for Alzheimer's disease, but rather they're having some of the effects of memory that's due to the aging process, basically. So it's not unusual to get a little bit of memory loss, a little bit of diminution in normal memory and cognitive function just by the aging process in general. And so that's what people get concerned with, and they come in and they think they're getting Alzheimer's. They think they're getting dementia, which is a
Right.
general term. And so dementia is sort of like a general term of that loss of memory and cognitive functioning, of which Alzheimer's disease is just one of the main one, but one of the causes. And so people come in and they think they're getting Alzheimer's disease, but they're having, healthy aging related memory loss, which is gradual and subtle, but can be concerning to people. So my advice to those people is, like, if you would come in to see me and you said, Dr. Kelaita, I'm getting Alzheimer's disease. What do you think? I say, well, Susan, you still, have pretty good intact memory. I might ask you some questions. I want you to remember 3 items and then go back to those 5 minutes later and see how many of those you can remember. And some of those questions might sound simple. What year is it? Who's the president? Maybe a statement of, a rolling stone gathers no moss. What does that mean to you? To see if if your mental functions are at a high enough level where you're able to understand the subtleties of a proverb or something like that. And I would say, well, Susan, it doesn't sound like you're getting dementia, or developing Alzheimer's disease, but rather, you're probably aware of a little bit of aging related, memory loss. why don't you take note of that? Let's revisit this issue in 6 months. If you feel that it's getting worse, I might want to have you do some further testing to see if it is Alzheimer's disease or whether or not some of those medications might be in order, and diagnose that more formally. But in most cases, people will come back and they'll say, well, I still just have trouble with names, or I still have trouble. And I ask my wife the same question that I asked earlier in the day. And
Sure.
she says, you already asked me that question. Yes, we're going to the doctor tomorrow. I told you that already. Those kind of things. So, that's not unusual for, all of us as part of the natural course of the aging process. So that's just something to, can sometimes be reassuring to people, that what they're experiencing isn't necessarily the onset of dementia, but rather some of that natural memory loss is a function of the aging process.
Well, I can tell you right now that every time they do those three things on TV, if I'm watching a program that talks about dementia, I can't remember them. I'm here to tell you, I can't
Yeah.
remember them, but
The things you see on TV are typically marketing messages, commercials, right?
okay.
And there's a drug that's on the other end of that commercial that a pharmaceutical company wants to promote. And so these aren't public service announcements that are meant to convey information or educate the public. These are messages that are tailored toward, marketing of specific drugs.
Okay.
So that's also something to keep in mind when you see those commercials. And they're kind of funny because they'll show a guy running down the beach and everything's great. And then they hit you with all of the side effects
Yeah.
of those medications. Right?
Like it could
Yeah.
cause you to die. Okay.
Yeah. The danger may cause, diarrhea, instant death, seizures.
Right.
People think, I don't know if I want to take that medication. So what I'll usually talk to patients about if they have concerns about dementia, memory loss, I say, look, do everything you can to maintain the health of your brain. That's the best preventative thing that you can do. So there's things that we do that can help promote brain health, like physical activity and exercise. When you get blood flowing, it takes nutrients to the brain, takes waste products away from the brain. So getting the blood circulating on a daily basis with regular physical activity is critical. And then avoiding certain activities that can be detrimental to brain health, cigarette smoking, alcohol, those kind of things can cause degenerative changes in the brain.
Sure.
So just keeping the brain healthy as much as possible is the best advice for that, prevention of dementia.
This week's episode is sponsored by The Commons at Union Ranch, a warm and inviting assisted living and memory care community. Call 209 425 0032 for more information about how your loved one can join this caring community. Absolutely. And then I kind of laugh because as blood pressure used to be normal, I think it used to be like 140 over something was normal, and now it's 110 over something is normal.
Yeah.
It's like it keeps
Yeah.
going down, just like
Not quite that low.
okay.
Yeah, and so we've moved the goalpost back a little bit because
Yes.
scientific studies show that people can start to develop some of the negative health effects of high blood pressure at a little bit lower blood pressure readings. Just, for the people who are viewing or listening to your program, I think it's just best to keep in mind 140 on the top and 90 on the bottom. The blood pressure is two numbers. You've got a
Okay.
top one and a bottom one, the systolic and the diastolic numbers. So the top number, the systolic number, you want below 140, and the bottom number less than 90.
Okay.
So that's pretty easy to remember. If you get one of those home machines, the ones that go on your wrist or the ones that go on your arm, it's something that people can monitor on their own and then, show it to their healthcare provider if their numbers are consistently elevated, and there's a concern. So, blood pressure, high blood pressure is, one of the most common health conditions that we see in primary care practice. And there can be negative consequences for high blood pressure. So that's something that people should be aware of.
So with the negative consequences of high blood pressure, physiology, I guess, is where I'm kind of going. I would say it's kind of like having a car that you're running the oil pressure too high, and so you're always putting more pressure, and then all of a sudden, boom, it's going to blow up your engine.
Sort of, sort of. That analogy, it breaks down a little bit because high oil pressure can be good for an engine because the blood is going through the little passages and lubricating, the moving parts of the engine well, up to a certain point, and then you'll blow out a seal and oil will squirt all over the engine compartment. But with the human body, if the blood pressure is too high, it can damage some of the small blood vessels. The blood vessels have linings. It's called the endothelium.
Okay.
And so that endothelium is delicate, and it can be injured if the pressure is too high. And then that can lead to a lot of the effects of high blood pressure on the body. So some people have seen those charts before. This is what happens when you have high blood pressure, and there'll be like a, person standing there, and it'll say the eyes, the kidneys, the heart, the circulation, all of those different areas of the body that can be affected. And it's usually because of the damage of those small, delicate blood vessels that can be harmed by elevations in blood pressure. And then that can lead to disruption of the normal circulation, the development of narrowings and blockages of the arteries, and atherosclerosis, which is like hardening of the arteries, but it should more technically be narrowing or blocking up of the arteries in the body.
And can that be reversed?
It depends.
Okay.
If high cholesterol is involved, so the effects of heart disease. So if you made a list of the top, so for people over 65,
okay,
what are the things that kill people? Right? What are the top causes of death? That's actually changed a little bit in the last 5 years. So typically the top causes of death have been heart disease, cancer, stroke. So now it's heart disease, cancer, COVID-19,
of course,
and stroke.
All right.
Right? So there's still an argument for COVID-19 vaccination because COVID's not gone. In fact, COVID-19 remains one of the top causes of mortality in people over the age of 65. So if we just take some of the other ones, heart disease, stroke, or what's called cerebrovascular disease, those are due in most part to narrowing, blockages, and disease of the circulation of the body. And high blood pressure and cholesterol are big components to that.
Okay.
And so is type 2 diabetes when the blood sugar starts to elevate. So keeping cholesterol low is probably one of the better ways to prevent narrowing and blockages in the arteries that take place. And that's what can lead to strokes and heart attacks. And that can be reversed. So the effects of cholesterol deposit in the arteries when you get a narrowing or a blockage, like almost all of us know somebody who's had, like a stent.
Sure.
Right? So a stent is, if you have a narrowing or a blockage in an artery enough, like let's say an artery that supplies the heart with blood, a coronary artery,
okay,
then you can fish a balloon in there and scrunch it open, and you can leave it alone, and it'll still work.
Okay.
But then there can be a tendency for that artery to want to close up over time. So if you leave behind sort of like a coiled spring that helps prevent the artery from closing up again on the inside, that's a stent.
Okay.
And so a stent left behind helps prevent the arteries from closing back up again, and you'll get a longer lasting benefit from the procedure angioplasty that helps open up an artery again.
Okay.
So all of that whole disease process that's involved in heart disease and strokes are due to various risk factors: high blood pressure, high cholesterol, smoking, genetics.
Right. Genetics is a big one.
Heredity, you can't do anything about that. That's just the hand that you're dealt.
Right.
But oftentimes the things that we do on top of that genetic predisposition towards disease, can be modified.
Right.
So, keeping cholesterol low and blood pressure low are keys to that.
I know I did do a couple times. I've done the life scan things when they send them out. And they, I did one when I was maybe 50, and it came back with some moderate plaque buildup somewhere in my arteries. It was pretty much in line with my age at that point, I guess, and I didn't really worry too much about it. But then sometime during COVID, I did another one, and all of that was gone. I had a completely clean bill of health, except for they did have this big red banner across the top saying I had to go to my doctor immediately. And I, in a panic, I'm going through everything. Everything's fine. Everything's fine. Get to the last page. I'm too fat. Oh, well. Not coming to see you tomorrow because I weigh too much. Sorry.
That life screening is a company that comes out, and they'll usually come to communities. They kind of, it's sort of like a rolling, you know, service that
Sure.
comes around, and they'll give you a flyer, or there'll be an ad in the newspaper or something like, "We're coming to the Catholic Church in San Andreas, life screening," right?
Right.
It can be helpful. Sometimes it raises more questions than it answers. But I think it can be helpful to do periodically, because it does do some screening for some of that arterial disease. They use ultras. Well, first they'll ask you questions. What's your weight? You know, what's your sex? And they'll measure your blood pressure. Sometimes they'll check a blood sugar. And then they use ultrasound to look at different areas of the body, the circulatory system in different areas of the body, like the arteries that take blood to the neck, to the brain. Those
Right.
are called the carotid arteries. The aorta, that's a big pipe that comes off the heart. And that's important to know if that's developing atherosclerosis, because that can lead to an aortic aneurysm. And an
Okay.
aortic aneurysm can leak or rupture. And that's all she wrote if that happens.
Oh, dear.
So it's good to know if people are developing or are at risk for those disease processes, and that's one of the things that the life screening can identify. But then sometimes for me on the doctor end, people go and they get those tests done, and they come in and they say, "Hey, I had this life screening done. Look at what it showed. What do I do about this?" And then I have to do some more specialized or more sensitive tests
Sure.
to kind of confirm whether or not that's true, because some of the testing that they use is sort of, like a lower technology screening test.
Sure.
And so sometimes it might not be as accurate. So an explanation for your test, like, "Hey, how come it got better?" Well, it could have regressed a little bit if your cholesterol was lower, if your blood pressure was lower during that interval that you had those done.
Right.
Or it could have been the case that the first one wasn't really all that accurate. And the
Okay.
second one, didn't, show it it wasn't there in the first place, that kind of thing. I don't know. It's hard to say. But I get people who have those, and then we send them for more extensive testing if that's the case.
Well, that makes sense. I would not substitute going to see them as opposed to coming to see you once a year. So,
Good. Good to know.
yeah. And I did just do my blood work at Mark Twain, which I'm happy to say came back just lovely.
Good.
Although this year I did kind of an experiment. I'd been really bad about my vitamin D, and I just thought, well, I'm not going to try to bring it back up. I just want to see what my normal living did to my vitamin D, and sure enough, it was like really low again. And the other thing I did is I did the fasting, but before I did the fasting, I went on a sugar binge. And when I looked at my glucose, it was like way up. It still was normal, but it was way up from the year before when I was really watching my diet. And
Well, most of that will clear out. The reason that we have people do fasting blood work is if I ate a Big Mac and you checked my blood an hour later, you'd be measuring some of the dietary cholesterol, dietary fats, that kind of stuff, and sugars
Sure.
in what I ate. So if you go at least 8 hours without eating, then you can get a better understanding of what that person's natural store or their baseline metabolism is for blood sugar, cholesterol, that kind of stuff. So people should still drink water. Sometimes I'll say,
Right.
"Okay, I want you fasting before you get your blood test done." And people don't eat or drink, since dinner the night before.
Right.
And then they go in and they get their blood work done, and they're, slightly dehydrated, and their veins aren't quite as easy to access.
Correct.
So people can drink water. That's fine. Drink plenty of water, in fact, to stay well hydrated so your veins can be accessed easier. And also black coffee is okay. You just want to avoid foods that contain sugar, fats, or beverages. So you wouldn't want to have sugar and milk in coffee. and
Right.
drink that and get your blood work done. But black coffee and water is not only okay, but probably a good idea.
I agree with that because I did one year, I don't know, maybe I misread the instructions, but it said just sips of water. So I stuck to it, sips of water. It's the only time I've ever had anybody have any trouble finding a vein in that. So after that, I went, I'm guzzling water. I don't care what this
Well,
paper
sometimes if
says.
people are going to have surgery or a surgical procedure, a procedure is just a baby surgery, right?
Okay.
In fact, it's such a small surgery. We don't even call it a surgery. We
Right.
call it a procedure, right?
Okay.
So like a colonoscopy or is a procedure, right? So if you're going to have a medical procedure, then they might say don't eat or drink anything after midnight.
Okay.
And then it's important not to drink even water.
Sure.
Because you don't want anything in your stomach because you might have to get anesthesia and that can make you throw up.
And you don't want to aspirate on the
You don't
table.
want to aspirate, get
Right.
food or water down the wrong pipe into the lungs.
Exactly.
That's aspiration, and that can be harmful. So those are kind of two different scenarios. But for routine blood work, it's okay to drink water. In fact, it's a good idea.
Well, I am really glad to have you tell me that because it's like I wasn't going through that again.
Yeah, people sometimes have trouble avoiding coffee in the morning.
I can get by without it, but that's the first thing I did after I got the blood work is I grabbed my coffee and said, yay. So let's talk about exercise a little bit. Again, the goalpost changed on that because when I first started talking about senior issues and learning about senior issues, that was 3 times a week, 20 minutes, go for a walk. Now it's 4 times a week, 40 minutes, go for a walk.
Yeah, it depends who you're asking. There's different, scientific organizations that issue recommendations, for good health. And so there could be a little bit of discrepancy. And that usually means that we don't really know for sure.
Okay.
Right? So how much should someone exercise? Well, it's not that easy of a question to answer. Typically, it's a good idea for people to exercise 4 to 5 days a week for 30 minutes at a time to get their heart rate up past your 80% of your maximum predicted heart rate. So that's kind of a complicated answer. I think it's just a good idea for people, especially the audience of seniors, people over the age of 65. To have some regular physical activity on a daily basis, right? I don't know that you need to set your watch and you need to do it for 30 minutes and have a heart rate monitor, and that's a little bit complicated. But routine walking, swimming, biking, physical activities that people do around their home, yard work, that kind of thing. So try to shoot for at least 30 minutes of moving.
Okay.
To the point where you're getting your heart rate. You feel a little bit of accelerated heart rate or a little bit of breathing, increase in your effort of breathing.
Sure.
For 30 minutes, 5 days a week, I think is a good goal for that.
Okay. I do go for a walk in the mornings, and it's a 40-minute walk. Sometimes it's 38 minutes because I walk faster. Sometimes it's 42 minutes. But what I've noticed is that as far as the clarity of my thought, if I go for a 40-minute walk in the morning, I cannot not work. I cannot just sit down and turn the TV on. I have to get to my computer. I have to focus. I have to go and do what I need to do. And I've noticed that effect will last for 2 days. I walk 4 days a week, so not always 4 days in a row. But I do notice that, I could skip a day, but then the next day, I really need that walk again to get my brain reactivated.
Yeah.
And I don't have a sedentary lifestyle. I've got rabbits, I've got cats, I've got a huge garden. I have a hill that I have to go down the hill to get to the garden, so I'm up and down all the time. But I'll tell you that walk, I can load the truck with wood and then unload the truck that same day, and that's about 45 minutes each. And I don't get the same effect as I do from my 40-minute walk. And I'm not quite sure, is there something special about walking?
I don't think it's the walking itself, but probably just the sustained nature of the walk. So let's say somebody works, I had a patient who worked at the hardware store.
Okay.
And so he worked an 8-hour shift and he was on his feet. He was helping customers. They were backing up trucks to the lumber area.
Sure.
They were loading trucks. They were, he was busy. At the end of the day, whew, he sat down and he felt like, he had, exerted himself at a high level.
Right.
But during that 8-hour work shift, he probably didn't have a sustained elevation in his heart rate for a full 30 minutes.
Okay.
And so that's what we think is the key. So, a person will say, well, doc, on Fridays or on Saturdays, I ride my bike to Stockton with the bike club.
Okay.
Right? And so if you added up all the time, you said 30 minutes, 5 days a week, right?
Right.
And so if I added all up that time and I bunched it all up into Saturday, then I'm cumulatively having the same amount of time. So I'm good, right?
Right.
Well, no, not necessarily, because the studies have shown that it's that sustained physical activity for 30 minutes on a more regular basis, 4 to 5 days a week, that
Okay.
tends to have the health benefit, as opposed to 5 hours one day a week. So
Okay.
it's a little bit on a more regular basis is more powerful than a lot on an occasional basis.
All right.
And so you may just be getting the effects of that more sustained physical activity when you're walking, as opposed to at the end of the day when you've been tending the chickens and walking up and down the
Right.
hill and moving wood and all the other stuff that you're doing.
Yeah. I mean, there's just no comparison. I mean, which I find interesting.
Yeah,
Yeah.
and there's also the theoretical reductions in the risk of certain health problems that you're benefiting from too, with that degree of exercise that you're incorporating into your lifestyle.
Right. Right. So we've talked about exercise. Let's talk about green leafy vegetables.
Okay.
Well, I read an
Yes.
article, and I think it was out of the Mayo Clinic. It was out of an organization that I felt was a legitimate organization. They had done a study with green leafy vegetables, and they said that it kept your brain plumper. And so my next question was, which they did not answer this question, is, well, let's say I ate lots of green leafy vegetables as a kid and as a young adult, and then, I don't know, from 30 to 50, I turned into potato chips and fried chicken, and now I'm back on the green leafies. So can I replump my brain, or am I just stopping it from getting any
Well,
worse?
You're better off going back to healthy, choices,
Uh-huh.
at any point in your life. I've had people who've smoked for 70 years, and they'll say, Doc, what's the point of quitting smoking? Whatever damage is done is done.
Right.
Well, that's partly true, but then if people quit smoking at age 70, they'll reduce their risk of, dying, and they'll live longer and they'll feel better,
Right.
at any age. So it's good to revert back to those good behaviors again, even if you've had a span in your life that you haven't been. And as far as, plumping up the brain, I'm not sure what they were referring to. Green leafy vegetables are healthy in a variety of ways. They don't have preservatives and chemicals and a lot of the things that go into food that can have detrimental effects to our health. So they're natural.
Okay.
And they have dietary fiber. That's good for digestion, can reduce the risk of colon cancer. And there are vitamins and nutrients in green leafy vegetables that you might not find as much in other foods.
Okay.
Like, for example, lycopenes, all the different vitamins, and things that have antioxidant properties. And so antioxidants are things that we think might reduce that process of atherosclerosis and some of the negative effects of the aging process in general that I had referred to before. So oxidation is where the body can be damaged or harmed by irritating types of chemicals. And so that's the process of oxidation. So antioxidants are things that help prevent that from happening and
All right.
can help prevent inflammation, irritation to different parts of our body, and even damage to sensitive parts of our body. So there's a good case for green leafy vegetables as part of a healthy diet. and it can affect, our health in several different ways. So I would encourage people to adopt those positive, eating habits despite not having earlier in their lives. It's never too late to change.
Okay. And I have heard, and research has disproved this since then, but it was my understanding that if you stop smoking, that within 7 years, about 7 years, your lungs have pretty much gotten back to where they
your
would have
risk
been.
of a condition called COPD or death or cancer gets back to the baseline after
Okay.
7 years. So when it comes to, let's say, COPD, which is primarily a smoking-related health problem,
Okay.
there's a small risk of COPD that slightly starts to increase as we get older. But when you smoke, it's very steep. And then if you stop smoking, it flattens back out again to the baseline.
Right.
So after 7 years, you're back to the same baseline risk of certain health problems from smoking as you were if you hadn't smoked.
Oh, that's really good to know. And that's good encouragement to stop at whatever age you are.
Yeah, right. Like I said, I've had patients that say, "Oh, I've smoked for so long, I've already damaged myself."
Right.
No. It's never too late to quit smoking.
That is really good to know. I'm glad to hear that. So we could probably go on for like ever. As this is a pretty interesting topic to me. But as far as aging goes and keeping a healthy brain, what other activities? We've talked about exercise. We've talked about good eating habits. And then, is there anything else you want to recommend for
Yeah,
people?
there's several things. If we look back 100 years ago at the causes of death,
Okay.
and we made a top 10 list, that list would look very different than it does today of the
Sure.
top 10 causes of death. So statistically, the things that people can do to maintain their health, live longer, prevent the icy hand of death, right?
Right.
There's things that people can do. And so it's those basic activities. The reason that we live longer today than we did 100 years ago is because we have access to better food, we have sanitation, we have living, environments that aren't as prone to developing acute health conditions like infectious diseases, that kind of thing. We have vaccinations, immunizations. So probably one of the tips that your listeners and viewers could get is that vaccines are going to be good to get. There's a lot of discussion about vaccines,
Right.
a lot of controversies around immunizations, but immunizations are very much the case, are very much why we live on average 35 years longer today than we did 100 years ago. And
That is
so
good to know.
those infectious diseases have been very much tamed by immunizations, meningitis, polio, different forms of pneumonia, gastrointestinal disease, respiratory infections like influenza.
Okay.
Those have made infectious diseases not in that top 10 list of causes of death today as they were 100 years ago. You'd have things like tuberculosis, meningitis, pneumonia, dysentery. You'd have those as your top 10 causes of death 100 years ago, whereas today they're primarily chronic diseases, like I said, heart disease, cancer, strokes.
Right.
But if you remember, I said COVID-19 has come up that list. So COVID-19 is now the third most common cause of death in seniors. And so that strengthens the argument for the importance of vaccinations.
So what vaccinations would you recommend that a senior over 60 get?
Yeah, well, it's not so much what I recommend; it's what the ACIP,
Okay.
the Advisory Committee on Immunization Practices of the CDC, recommends. And this is just like a group of really smart people.
All right.
They get together every year. It's a large group of people, and they look at the data, they look at the risks of disease, the incidence of disease, and they make vaccine recommendations to the public. And so for people over the age of 60, when you talk about vaccines in general, there's childhood
Sure.
vaccinations and then there's adult vaccinations. So for seniors over the age of 65, one of the more important vaccines to get is an annual flu shot.
And do you recommend the super flu shot?
The high dose
Yes.
flu vaccine.
Yes.
So there's different forms of influenza. When we say a flu shot, we mean an influenza immunization.
Okay.
So influenza is a respiratory condition that causes cough and fever. Pneumonia can be a common consequence or byproduct of influenza, leading to hospitalization and even death. And 36,000 deaths each year are attributed to influenza. So the vaccine, the influenza vaccine, we just say the flu shot. Right?
Okay.
So the influenza vaccine has a new formulation for those over 65. It's called the high dose flu zone vaccine. And so they increase the amount of what's called antigen in the vaccine by 4 times. Because as we get older, we don't respond as well to vaccines. Our immune system sometimes needs a little bit more of the stuff to be able to mount an immune response as we would when we were younger. So the high dose vaccine is more effective. So for people over 65, if you have an option, I would recommend the high dose flu vaccine. If that's not available for some reason, if you go to CVS and they say, well, we're out of that one, then get the regular one anyway. Because we've been using the regular one for generations, and it's been shown to be safe and effective. There's a couple of other vaccines too that your listeners may be interested in. For example, the new version of the COVID-19 booster is recommended. And so these versions of the COVID-19 vaccine have been tailored to match some of the new variants that are circulating in the population. And so those haven't been covered as well by the original COVID-19 vaccine. And so the newer versions of the booster vaccine have been reformulated to take into account some of the new variants that we see circulating. So I would suggest the new version of the COVID-19 booster sometime between now and the end of the year, and also one that's called the RSV vaccine. I don't know if you've heard of that one, the RSV.
I've heard of it. It's relatively new, and
it is new. So RSV means respiratory syncytial virus, and this is another type of viral illness that can circulate in the wintertime, leading to hospitalization and even death in high-risk cases, in high-risk people. So it's not new, but the vaccine is new, because we've seen now with the advent of COVID-19, the incidence of increasing of COVID-19, that RSV together with COVID-19, together with influenza, creates a situation where you're very much at increased risk.
Sure.
And so RSV vaccination has been shown to reduce hospitalizations and mortality in people over the age of 65. And then, one more vaccine real quick would be the pneumonia vaccine. So the pneumonia vaccine now that's being used is called Prevnar 20. And so that's a PCV, a pneumococcal conjugate vaccine that has 20 different strains. So it's just known as Prevnar 20. So Prevnar 20 is the new pneumonia vaccine that people will get. And it's recommended just after the age of 65 in a one-time dose. So you get a pneumonia shot one time and you're done.
Okay, so if I got one last year, that means I don't need to get one this year?
You don't need another one.
Okay, that's good to know.
That's an easy one.
Yeah. So the one you haven't mentioned that I'm actually kind of curious about is the shingles vaccine.
Yeah.
Because I understand that Dianne Feinstein had a shingles vaccine, but boy, it sure didn't help her out very much.
Well, shingles is an interesting disease. When you're young, let's say you're a kid, you're 10, you get chicken pox.
Right.
And you get a rash from head to toe, and it goes away, but it never really goes away all the way. It stays asleep inside your body, and it can lie dormant for 60 years. And then when it wakes up, it comes out in a very special way, because it was asleep along the nerves of the spinal cord.
Oh, okay.
And so when it wakes up 60 years later, because maybe you're immune, we don't know why exactly. Why does it wake up? We don't know why exactly.
All right.
Maybe as people age, the immune system's not as strong, and so it doesn't keep it in check as well. Sometimes people take certain medications that might reduce the effectiveness of the immune system, transplant medicine, steroid medications like prednisone, things like that. So,
Okay.
and then for reasons sometimes we don't know why. So let's say that the chickenpox virus that was asleep inside your body woke up again. Then it comes out in a very special way because it was living along a nerve of the spinal cord. It will usually come out as a patch of a painful blistery rash.
Okay.
And so that rash can either be in the chest, it can be around the face, it can be in different parts of the body. It won't be in various parts of the body because it only comes out in one nerve.
I see.
So people say, Doc, I got shingles. And I say, okay, let me see. And I got a little here, 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 I got a little here. And they point to different various areas of their body all over. I'd say, that's not shingles because shingles will only come out in one zone of the body. And you get that painful blistery rash. Now, it's rare that shingles is a fatal disease or leads to hospitalization, but it can be painful,
Right.
and it's a nuisance. And so that's why the shingles vaccine can be helpful. So the shingles vaccine is just basically a turbo chickenpox vaccine.
Okay.
And so it can be used in all cases for people over the age of 65. Because let's say you never had shingles. I mean, you never had chickenpox, sorry.
Okay.
You never had chickenpox when you were a kid. Well, then you won't get shingles because there's nothing in you that's dormant that can wake up. But you can get chickenpox still.
Okay.
In fact,
Yeah.
in fact, if adults get chickenpox, they can get more sick from it. Let's say a pregnant woman gets chickenpox. That can be devastating to her developing fetus and her pregnancy. So if you're an adult and you get chickenpox, that's not good. So the shingles vaccine can prevent you from getting chickenpox if you never had chickenpox.
Okay.
Let's say you had chickenpox when you were a kid. Okay, now you can get shingles as an adult. And the shingles vaccine will remind your immune system that you've had chickenpox, and it'll help keep it asleep so that it doesn't cause shingles.
And is that a one and done as well?
Well, it's a 2-shot series.
Okay.
So it is a one-time vaccine in the sense that once you've completed the series, you don't have to get it again later in your life. But the series consists of 2 vaccines, usually separated by a few months. So it's a 2-shot deal.
Okay.
But it's also recommended. Now, people, if they get the vaccine, they can sometimes still get a very mild case of shingles. So it may not prevent it 100%, but it will reduce the incidence of it. And if people do get it, they get a much milder case of shingles.
Well, that is good to know. So we're getting pretty close to running out of time. I do have one more drug-related question.
Okay. Lay it on me.
Well, this one's, I think, pretty easy. I had TB when I was in college, and I took a year of pills, and then I guess I was good. And then ever since then, when you're listening to the TV and the ads come on, and they go through all the list of blah, 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 of bad things that are going to happen to you if you take this drug, quite a few of them list, and if you've ever had TB, you can't take it. And then I go, oh, good, I can't take that drug. I'm really glad. What's the deal with TB and these drugs?
Well, when we say TB, we mean tuberculosis.
Correct.
Tuberculosis is a bacterial infection. And if someone has TB, and they can be contagious to another person that doesn't have TB, because they'll cough and the little organism that causes tuberculosis will be suspended in the air. And let's say someone's sitting behind you on the bus, coughs, and they have TB, then you can inhale the little bacteria, and it sets up shop in your lungs, and you get a very low-grade infection. You might not even know. You might not even be sick. And if you do a TB test, it'll be positive. That means you've been exposed to TB, and it's dormant in your lungs, but you're not actually sick. You don't have active tuberculosis. You're not coughing. You're not losing weight. You're not sweating bullets all night long.
Okay.
You're not doing all the things that people do when they have active TB, but you can still have latent TB infection. That means you'll have a positive TB test on your skin or in a blood test for it, and you have latent TB infection. And that's why you take that medicine for 9 months or a year, whatever you did,
Right.
because that'll help prevent it from becoming active TB later in life as you get older.
Okay.
So if you do have latent TB infection and you don't know it and you're not sick, and if you take drugs that reduce the effectiveness of the immune system, then it could help it wake up.
Okay.
And so that's those things that you see advertised on TV, those drugs for things like rheumatoid arthritis or for psoriasis or for certain types of intestinal conditions like Crohn's disease. These are diseases where the immune system starts to attack the body. And so some of the drugs for those medical conditions actually reduce the effectiveness of the immune system a little bit. And so if you have a problem that the immune system is keeping quiet and you reduce the immune system, maybe it'll help, maybe it'll wake it up
I see.
a little bit. So you can get tested for TB before you take those. So when you hear those, let's say you have Crohn's disease and you need to take one of those drugs, the doctor will test you for TB.
Oh, that's good to know.
And if it's negative, then you go ahead and take it.
Right.
But if it's positive, then you have latent TB infection even though you're not sick. And if you take that drug, it could cause active TB.
All right.
So that's the precaution of those.
That is good to know. Well, I really appreciate you coming and talking
Sure,
to me
Susan.
today.
Thank you for having me.
You're welcome. Is there any pearl of wisdom you'd like to lay on us before we...
when it comes to things that people can do to stay well, to prevent disease, to live longer, I don't have a magic, potion,
That's too bad.
Those things that you see advertised on TV, lots of supplements, vitamin C, these kind of things. There really hasn't been a lot of real good scientific evidence that those things help that much. I've had a guy come to see me. He had a box. He had probably like 100 bottles of all these different supplements and B complex and, herbal medications and, all this. He says, look, doc, I take all this stuff. Isn't this great? I say, well, I don't know that you need all that really. Spend $1,000 on all these different supplements.
Too.
Right? So I think a multivitamin once a day is fine. In women over 65 who are postmenopausal, vitamin D and calcium are good to protect the bones. Sometimes people take things at night to help with sleep, like melatonin and certain B vitamins, magnesium, things like that. Those are fine. But, I don't recommend people, I'm not a big supplement guy, that go out and buy all this stuff and spend all this money. I think it comes down to the things that are, relatively boring and things that your grandma might have told you when you were young, right?
Yes.
Get enough rest, have a balanced diet, stay physically active, don't drink alcohol a lot or smoke cigarettes, those kinds of things. So that's basically the take-home message. It's those things that we do every day as part of our lifestyle that will translate into, us being healthier, feeling better, and living longer as we age.
All right. Well, that is good advice. Thank you again.
Okay.
And thank you to all our listeners and viewers today. Please come and join us again for the next episode of Senior Moments. This week's episode is sponsored by The Commons at Union Ranch, a warm and inviting assisted living and memory care community. Call 209-425-0032 for more information about how your loved one can join this caring community.